Hey everyone, and welcome back to the Health IT Playground, your location, your stop to get information about the health IT careers out there with your name on it, right? It's a perfect place. So thank you guys for joining. I'm excited today, as you can see, because I have someone here who's going to teach you guys about a term that is so popular in health IT that if you have even been in it for about a week or two, you're going to hear this four-letter word. The word is EPIC, epic, epic. It's big, it's important. And he is here to talk to you guys about how to become an epic analyst, a very important career in health IT. He's also a content creator for YouTube. So if you have not found him yet, learn about him here today, follow him as well, and he'll talk about his channel later on. So happy to have him here. Gabriel Chavez, thank you so much for joining our show.
Hi, Juliette. Thank you for that introduction. And hi, everyone watching. My name is Gabriel. I'm an Epic Analyst. I work at one of the top research hospitals in the world. And I'm also a content creator. My YouTube channel's name is Our Epic Journey. And on there, I help healthcare professionals transition into Epic Analyst roles, but also Epic Credential Trainer roles. So if you are interested in anything related to Epic, honestly, you can look up my channel, and I'm just very excited to have this conversation with Juliette here. She's bringing so much value to the health IT world, and very excited to answer some of the questions that might help you guys out in your career transitions or just career in general.
All right. Thank you so much for joining me on the show. And I always, for the people that know, ask this question first. I learned about health IT from podiatry school. How did you learn about health IT?
I used to work Kaiser Permanente for about 4 years as a patient service representative in the radiology department. I work at the front desk scheduling radiology procedures. And the first time I encountered health IT was I've used Epic EHR throughout my job there, but the first time I was like, oh, okay, this is something that there's a job out there for. In the past, I would think Epic EHR was just software that was hard coded that you could edit or customize. But the first time I realized that you were able to do that was when we had a transition of paper forms into iPads for filling out radiology questions before a procedure. So we had a workflow change with Epic, and I noticed how powerful health IT can be in the sense of capturing discrete data, capturing the data that was in the past filled out on the paper form, wasn't able to be accurately used on the back end with software. But now, since they can click on iPads and this data is stored electronically at Epic automatically without having to have this form and then upload it as a PDF to the EHR, everything was automatically just connected. And then it made an interest in me in technology, and I just dug into health IT more after that moment, honestly.
Okay. So for you, it was all about seeing this transition from using paper to having patients now using an iPad, which is mind blowing, especially back then to have a patient use an iPad to check in. And from there, that kind of started your journey.
Yes.
Starting your journey, what does that mean? Did you go back to school? What were the steps that you take? Did you shadow someone? What was your direction from there?
So I actually did not have a background in like health IT. I went to school for kinesiology, which is just another fancy word for exercise science. And that's what I studied at school. I wanted to become a physical therapist. So that's why I did kinesiology. And the interesting part about it was that I graduated right when COVID started. And so it was difficult because I was doing an internship at a physical therapy office. And then out of nowhere, I had to be, I had to leave my internship pretty much because I was working with the elder population, and I can give them COVID working at the radiology department, since the radiology department works 24/7. They work alongside the CDU, which is like the emergency department in an outpatient setting. And I had to leave my internship. So I was bummed about that. And at the same time, I felt like it was like fate. I was like, okay, maybe physical therapy isn't for me because I wasn't really enjoying it. When I was working there as a tech, helping the physical therapist, I noticed it was very repetitive. It was slow. And I felt like you can only help patients one by one. And I felt I had something in me that I would want to help more people with what I do. And that's where technology came in. That's how the start of this happened, where it was like COVID happened and it switched my path. I feel like if COVID didn't happen, I probably would have gone to physical therapy and probably hated my job because of how slow it was, and it felt like it wasn't for me anymore.
I never thought I would say this, but thank God for COVID. Thank God it helped you get to the point of realizing and discovering not only health IT, but also taking that step to pursue it. That's awesome. So you went to a program, you finished the program, and then what did your journey look like from there? How difficult was it for you to get your first position in the health IT space?
So as soon as I realized that I wasn't going to do PT anymore, and my focus was now in health informatics, health IT, I decided to look for jobs related to Epic. So not directly being an Epic analyst, but being a credentialed trainer. So there was a job post that happened during that time. It was for a hospital transitioning from Allscripts EHR into Epic EHR in DC. And I decided to apply for it. I didn't know I was going to get this job, but I was so happy that I did get it. And during that job, what we pretty much did was we learned multiple applications. So Epic has a bunch of applications. It's not just one application. We had to learn a couple applications each trainer, and we were taught by a primary trainer in these applications. And then at the end of the training of that, it was an in-house training, we were tested in our knowledge of the application. So we were able to teach it into primary trainer. Then we passed and we were credentialed. So that's what an Epic credential trainer is. It's just getting like passing the test in-house in your healthcare organization that is assessed by the primary trainer. So if you pass that, then you become a credential trainer. And then I just started teaching how to use the software. And I feel like what helped me a lot with that job was my experience using the Epic EHR at Kaiser, working as a front desk person. Okay. Let me backtrack to where I was talking. So I was teaching. Okay, so we were teaching. I was teaching the ambulatory application. I was teaching the Willow application, and it'll make sense a little bit what those mean. The Willow application, and then I was also trained in Healthy Planet, right? So these terms sound probably a lot of people don't know what this means. So the ambulatory application is the application that deals with outpatient clinical documentation. So anything that's outpatient, right? The Willow application is the pharmacy module that Epic offers. So anything related to pharmacy, that's the Willow application. And then third, it was the Healthy Planet application. Healthy Planet is an application that deals with population health. So tracking the health of a patient outside of the hospital, things like social determinants of health or like medication management, like they're following up on taking the medication. Someone always follows up with the patient and make sure that they're following the guidance that the doctor set out for them. So I learned those three applications, and I was teaching doctors, nurses, pharmacists, pharmacy techs. I was teaching a group of people in the classroom and sometimes also virtually. So I would go to the office, teach them, and then at the end we would give them a practice exam. And if they pass, then they pass their application, and then they can get what's it called? And they can start using the EHR. They can start using Epic EHR. Now they were certified, and like we taught them, so they should know how to use the system. So that was my experience working as an Epic credential trainer, and I feel like that's might be the first step for a lot of people, since you learn a lot by understanding the workflows of Epic EHR.
I have a couple of questions that popped in my head as you were explaining your journey here. First question, which I think is hilarious, is the fact that you are giving doctors and nurses exams, and you can fail them, which I think is very cool. So how was that experience working with the providers and the nurses and the other healthcare professionals in that way? What was that experience like for someone that is listening to you and is gaining interest in what you're saying?
Of course, it sounds terrifying at first, right? You are, like you said, failing clinicians, doctors. So it's scary at first, but on honestly, as long as they see that you care about teaching them the system, it's not like it's just your job, like it's something that you are passionate about, then it's easier to have a relationship with them and be like, okay, you're doing something wrong, and being able to tell them in a nice way instead of saying, you're wrong, here's an app, get up. You have to go at it as you care about them learning the system, because you do care about the patient care, right? If they don't learn the system correctly, patients can get hurt. So you have to go about it that way. You have to go about it in a caring way. And they notice that, like doctors or nurses, they notice that you care about the learning and you're not just doing it as a job. And they are much easier to work with when you approach it that way.
Okay, perfect. And my second question was, there are jobs all over the place, and I've seen these Epic jobs where they're asking for loads of experience to know all these different systems before you apply. Is that something that you recommend that someone does right now in this time? Let's say that I wanted to apply to a job and I did not have any experience in Epic, but I wanted to be a trainer. Should I still apply? Or should I just not apply because I don't fit what it said? Like, I don't fit what the description says.
Right. Yes. So I think you should still apply if you come from an educational background. I've heard a lot of other trainers that came, for example, my primary trainer that was teaching me at that organization, she didn't have any experience in healthcare. She actually came from a school. She was a teacher. I think it was high school, and she just got the job as a primary trainer. So if you're in education, if you're working as a teacher, I think I do recommend for you to still apply for the Epic credential trainer jobs, because you will still get hired for these jobs. There's no, like, the prerequisite of having healthcare experience is not there. As long as you're able to teach something, then you should be fine.
Okay, and I have two more questions. Are these positions, I know being remote is like the thing right now. So are these typically remote positions, or are they positions that you would have to go to a physical facility to go to? I think I know the answer, but I want you to say it.
So during the COVID time, it was honestly like it was 50% I would do it remotely, 50% I would do it in person in the class. I feel like now is more towards in person, since COVID is not a problem anymore. So you most likely would be working in person if you want to become an Epic trainer. Yeah.
Okay. All right. For those that are looking for remote jobs only, this is not going to be your thing. This is just FYI. Those are like, I want remote work only. This is not for you. But I am encouraged to know that if you are or have education experience, and this could be a great route to take to get your foot into the door. That's awesome. The training that you mentioned, how long is training for these positions, or just to learn to be a trainer?
So once you get hired, it's about 6 weeks, 6 to 8 weeks of training. And then after that, they give you the test. If you pass, then you go on to become an Epic credential trainer and teach others. If you fail, you get, I think, 2 or 3 tries. So if you don't do it the first time, then you can keep trying. But if you fail like your third time, I think they won't take you any longer. But there's options, or there's a leeway in terms of fail the first time or not. Because if healthcare is your first, if this is your first experience in healthcare, then most likely you might fail, right? There's some terms that only healthcare people know, but they give you the benefit of the doubt, and you can still continue to achieve a credentialed trainer if you fail once, at least. Yeah.
And last question before you move on off of this. Salary. I'm not asking you to tell me what the salary is. I wouldn't have people do their homework, but I'll say, is the average salaries that are posted online, is that accurate in your opinion from what people could expect to receive from this type of position?
So I have 2 main things to say about this.
Okay.
So there are Epic credential trainer consultant, and there are regular Epic credential trainer.
Okay.
If you're a regular one, salary is pretty low. I want to say it's like between $20 an hour to $25 an hour.
Okay.
If you are a consultant, I've heard that the salaries can go up to $40, $50 an hour, because you're only there for a period of a time. So it's only for a contract. So, for example, like a healthcare system transitions to Epic, right? They don't need Epic trainers like their whole lifetime, right? They just need them for a couple months. So that's the reason why they get paid so much as a trainer. And if you like working, if you like flying around the country, is like being a consultant as an Epic credential trainer might be your thing because they get to fly lots of places and they pay for things like that if you're a consultant.
Okay. So you start off as this Epic credentialed or certified trainer, training healthcare professionals and getting them through. What happened next in your journey? What was that next step for you?
So working there as a trainer, I feel like gave me the confidence to start applying for analyst role. I feel like if I didn't do this step, I wouldn't have the confidence to start applying for them and even in interviewing for them because I felt like I wouldn't know what. So what I decided to do on the last days of this, it was a contract job. So what I was doing was a contract job. But what I decided to do in the last days was reach out to the hiring managers of Epic Analyst and then ask them if they have any openings. So one of them gave me a chance. They were like, we have an opening for patient access Epic Analyst position. And then I was like, cool. I was like, okay, can I interview for it? She was like, yes, but you need to take the Sphinx test first. So a Sphinx test is a test that it's a very hard test that it's hard to explain what's on there. So it's not like it's healthcare. What's your healthcare experience? Like answer this question. It's not like that. Like GRE. So the exam you take to go into graduate school, it tests you in terms of like you read a passage, right? And then you have to pretty much answer a question based on that passage and your time on that exam. So that's what the Sphinx test is mainly about. Also, there's math in it. So it's a little bit of everything. It's like general knowledge. So it's not like specifically Epic knowledge that you have to learn or know for that. So I decided to take the Sphinx test and I was like, oh my God, I never heard about this exam. How do you even like review for this exam? So I couldn't find anything online. And then I was like, okay, let me just apply for it. Let me just take it. I took it and I failed. So I failed my Sphinx test the first time. It didn't make sense to me, honestly. Like there was also a pseudo coding part, which is like fake code, which I think they don't do anymore because of how hard it was. And I failed it. So I never got the interview with the manager for that Epic Analyst position. I was so like discouraged. I was like, okay, then I probably can never be an Epic Analyst, right? But my wife gave me hope. She was like, don't listen to a dumb test. It's just a test. It doesn't mean like you're not smart. So I was like, you're right. So then I kept applying for Epic Analyst jobs outside of that healthcare organization. And I got my first break with this company, which was a consulting company that were, so another thing. So it's not just healthcare organizations that can give you or certify you for Epic Analyst positions, but also consulting companies. So this consulting company was working with a healthcare organization and they took over all of their like Epic Analyst department. So that it was like they're a contractor for that healthcare system. So they gave me a chance and they didn't ask me to take the Sphinx steps. So not every organization is requiring you to take the Sphinx step. They didn't ask me to take it. And I guess I just did well in the interview. I just talked about my experience as a trainer, which helped a lot, I think. And that's why I recommend people to start off as a trainer first. I did that. And from there, they were like, okay, you're hired. And then a couple weeks after, they signed me up for classes to get certified in Epic. And I did it virtually during that time because it was during COVID. And that's how I got my first break into being Epic Analyst through that company.
And well, first off, congratulations. That's a beautiful journey. I love hearing stories where it's just heartache and then it's like a breaking point. You're like, okay, it all ties in. So how life works. But as an Epic Analyst, what exactly are you doing? Is it similar to data analysis? What does that mean to be an Epic Analyst? I think that's a question that nobody really gets.
So I can put them in two categories. So when I started working at that company, when I first hired, I was a fresh analyst. What I worked on was just break fix issues. What that means is that if something is not working correctly in Epic for an end user, I would fix it on the back end through looking at how the building block. Okay, let me backtrack. But Epic is an EHR company, right? It's an electronic health record company, and it's a software at its base, and it's customizable for people that have access to it as a certified Epic Analyst. And what you can do with that is a lot, honestly. If you have a workflow that you want to update, an Epic Analyst would do that. And how hard to explain it without showing you like what exactly we're doing. But if you can think about it, it's like a software engineering job,
Okay.
or without code. You just move things, like you point and click through things, and you have to learn the relationship between databases. So that's the main part. So I like people that ask me like, okay, like what do you do on the back end? You have to figure out, like, let's say this column here, how does this column here link to these other columns here? And that's how you build stuff. So you have to figure out, if you update this column here, you update a record on here, how is that going to affect this other record here that does something else inside the software? And you can, and that's what a entry-level analyst would do, which is look at where that row of data is that's wrong, the record, and you would just remove it or add something else that was missing. That's what you do as an entry-level one. But if you're intermediate or advanced, then you start analyzing these connections at a wider level. So you start seeing the relationship between multiple databases, and based on that, you can build bigger things. You can start building stuff. So they call them like builders, like Epic builders sometimes, because what we do is build on the back using the EHR software. So I'm not sure if that explained it well enough, but you can.
Yeah. I get it. And that's us. That's primary key, foreign key, relational data. So you're pretty much doing that without using SQL or any type of coding, pretty much.
Right.
How does somebody prepare? So I am a ideal person watching this video. I'm so loving what you're saying. How do I prepare myself to be mentally prepared for this type of role?
I think what prepares you is the training that you have to go through, which is why they send you to Verona. Like, they do an in-person training. They want people to do in-person training. In the past, they did virtual training because of COVID. But before COVID, you could not be Epic certified without having to travel to Wisconsin, Verona, to get the training by their own people, like their own trainers. They're the ones that work within Epic headquarters. And I think that's made by design, because it's such a complicated thing to teach, and it's best taught by people that understand the system. And that's why they have you go to the training there. So that's the number one thing, is getting taught by these trainers. The second thing is honestly just playing around with the software, just messing things up. So you have, like, when you first get trained, let's get sent to Verona, Wisconsin, you have an environment where you can build things, and it's fake. Like, you can do whatever you want, you can break things, and that's honestly the best way to learn. Just move things around, see how that changes how it looks on the front end for someone. And honestly, that's the best way to learn. Just break things. And that's what we do actually on a day-to-day too. As a real like Epic Analyst that's not like being trained, we have different environments. So like software engineering. In software engineering, you have different environments where you build something in the lower environment, right? You test it. If it works, it goes to the next environment. And then you test it here again. And if it works, then you finally push it into production, which is like what the front end sees. Same thing with Epic. You build it in a lower environment, in like a proof of concept environment. It passes, then it goes on to a testing environment. And then you have someone outside of you, so not just you, but someone else tests it. And if it works, then you put it into production. If it doesn't, then it does not go to production. So that's, even nowadays, even as an experienced Epic Analyst, we still try to break stuff. Honestly, that's the best way to build something. Try to break it. Try to see, like, how would an end user click something here where it would mess the functionality of what this workflow is like on Epic. And that's what we have to do to build stuff. We have to break stuff, try to break That's the best way to explain it.
It sounds like this is like a software engineering role, essentially just Epic specific and without needing to know coding, but I guess knowing Epic code per se. Financial, two questions. Financially, is this, and I'm not saying to share your salary because that's not, no, but salary wise, is this a major jump in your opinion? I would hope yes, a major jump from being a Epic trainer or an Epic consultant.
It definitely is a big jump. And I think what's most best part about being an Epic Analyst, I don't think it would be like the pay part about it. It's honestly the remote aspect of it. Being able to work remotely, because as a credential trainer, you're going to be sent to these locations, right, throughout the United States or even outside the United States. We have hospitals that want to transition into Epic. As Epic Analyst, there are lots of remote jobs. Like, I think majority of them might be remote. And that's the good part about it. And then also the pay obviously is greater than as a trainer. And there's also two tiers, right? If you work for a health system, you get paid less. If you work for a consulting company, you get paid more. Because in the health system, the people that make the money are the clinicians, the doctors, right? That's the main purpose of a healthcare system, right? Is that care. But if you work as a consultant, then the breadwinners of a consulting company are the consultants. So you would get paid more. So significantly, like it would be maybe like a 20 to 40K more than what a trainer made. Yeah.
Perfect. Okay. So for those that want to be remote, you can do it. You just have to maybe train first for a little bit and then transition. Now, what if I don't want to be a Epic credential trainer? What if I want to become an analyst, but in a different, or take a different avenue? Is that possible? Do you have to be a trainer to start and become Epic, or to transition and become an Epic analyst?
I don't. So you don't have to be a trainer to become an Epic analyst. I just found that path worked for me. And people that probably have a bachelor's degree in information systems, they would be better suited for this job off the bat with their bachelor's alongside their health experience. So what I tell people is that you have to be tech savvy and also have the healthcare experience to go directly into an Epic analyst. If you don't have one of those, then it's best to have that middle ground, being the trainer first and then transition into an Epic analyst.
Yeah. Gotcha. And to piggyback off of that, traits of an Epic analyst. If you were to give me 3 traits that every Epic analyst should have, what traits would those be?
So number 1 would be curiosity. So curiosity in terms of, like I mentioned, like breaking things or fixing things. There's going to be a lot of times where there's going to be an issue and you're not going to exactly know where it is. And you just have to dig around, even maybe for hours, to figure out where that record is misplaced or someone did it wrong. And you have to like just constantly look into they're called master files. So look into the databases, into the columns or the rows. And number 2 trait would be someone that has good skills in terms of making things that are complicated seem simple. So you work a lot with end users, and you should be able to explain complicated concepts to someone that doesn't have the knowledge of the back end of Epic. So that's number 2 trait. And then number 3 would be this is good. So being able to create relationships with other Epic analysts at your organization. So the more experience you get, the more you're going to have to be working with other applications. So I currently work for the cardiology and radiology, the Cupid and Radiant. If I want to do bigger things, create bigger projects, I'm going to have to, work with Access. I'm going to have to work with professional billing, hospital billing, all these other applications. And if you don't have a relationship with them, the project will stall. It won't move forward, right? So being able to make friends in where you work, and definitely will help you, be a better analyst, and also put your name out there in terms of this person gets things done at a healthcare organization. And then the higher ups would love people like that can get things moving. There's a lot of, especially in healthcare, there's a lot of blockers. They have to get approved by this council. And so that'll be the number 3 trait an Epic Analyst should have in the list.
Right. Perfect. Now, are there any professional associations that you would recommend for someone that would like to network with other Epic analysts?
So there's a LinkedIn professional group that's called Epic Professionals Certified and Credentialed. That's one of them. And then there's another one called Epic Implementation Professionals. And if you join those groups, you're going to see a lot of job posts that people put there. But the thing with that is that it's usually for certified people, like I mentioned, or credentialed people. So if you're brand new, this might just be a way for you to connect with people that are already certified. And I'm trying to create my own community where I do have job posts that are for people who are not certified. And if you're not certified, I would go to there because I do post jobs that don't require you to have a certification. And there's the key term that you should look for in the description of jobs, which is we'll certify you in 6 months or 8 months, whatever the thing is. So if you see a job post and it says we'll certify you in this amount of months, then those are entry-level ones because they're willing to certify you. So that's like the key phrase that you should look for in a job if you're looking for one.
Okay, I love that. That's a nice nugget for them to take away. Where do you see yourself in the next 10 years? You're working at a awesome institution right now as a Epic analyst. So where do you see yourself?
Where I see myself is honestly just continuing to learn. I think there's so much information that even like with my own applications, like probably 50% or 40%, like there's so much more. Like even people with 6, 7 years of experience are still learning new things about their own application. So I would continue to learn, maybe eventually become like a lead if I'm like understanding everything at a level where I can help other people with their builds and things like that. And also I see myself creating content, helping people that want to get into these Epic Analyst roles. That's why I do see myself in the future.
Now, you did mention having your own group for those that are entry-level individuals, or maybe someone who isn't entry-level, but just wants to be a part of your community. Tell us more about your community and also all the things that you currently are doing outside of your 9 to 5.
So my community is a Microsoft Teams community, and mainly it's for people that have access to Epic User Web, which is how you know if you have access to Epic User Web. If you work in a healthcare organization and you use Epic, then you pretty much have Epic User Web access. So if you're a person working in the healthcare if you're a person working in the healthcare world and you use Epic for your day-to-day work, then you most likely have Epic User Web. What I do in my community is that I actually search through all of the organizations that are linked to Epic and then go through each of their websites and then search for Epic Analyst jobs and then look for that key term that I told you about, which is we'll certify you. And then once I do that, then I post it on my community, my Microsoft Teams community. That way it's easier for people to just have a place where everything is already in one spot instead of having themselves look through all these healthcare organizations to their job posts. Because I noticed that if you search on Google, just Epic Analyst jobs, majority of the job posts are certified positions. So
yeah,
if you want to find one that's not a certified position, that's the method. So go to the healthcare organization's career website, search for Epic, or search for analyst, or search for system analyst. I also have like key terms of what to search for. I don't remember all of them on the top of my head, but those are some. Epic, system analyst, EHR analyst was the other one. I'll probably let you know which ones those are, Juliette. I don't remember the top of my head.
Oh, you're good.
So we have those jobs, those entry-level jobs. And we also have a question section where, if you have questions regarding a self-study proficiency, which is another term a lot of people probably didn't heard about, but it's what that is. It's Epic training, which you can do virtually at home, but you're not technically certified. So if you apply for jobs that are certified, they don't take that certification, but it's a way for you to learn the back end of on your own time. So it's called self-study proficiency. So if you want to do that, you have to reach out to your manager. If you use Epic in your current system, reach out to your manager and then ask them if they're willing to give you access to this self-study proficiency training. It's a training offered by Epic themselves. And if your manager says yes, then you would just send an email to Epic headquarters, to the actual Epic website, and then you would get the training added on to your Epic's user website. And then you can complete there's a project portion to it too. So you can complete a project, you can get hands-on experience with Epic building and stuff through that method too. But you just can't find jobs with that certificate. It's not a certification. It's just like people won't take that as a certification, but it's for your own knowledge if you really want to dig into it.
You do have a YouTube channel, of course. What is the name of your YouTube channel? How can they connect with you and watch more of your content?
So my YouTube channel is called Our Epic Journey, and I try to upload at least once a month, but I'm trying to do it twice a month. I recently got a video editor, so I can crank out these videos faster. And feel free to check out my latest video. It's about a revenue cycle Epic application. So if you have experience with revenue cycle, it pretty much tells you what is the most in-demand Epic application to look for if you have the background in revenue cycle. But I make these videos to help, like I mentioned, help people transition from healthcare roles into Epic Analyst roles.
There are a lot of people that are trying to figure out how exactly to transition from a role like a patient service rep or patient access. And how do you get from that entry-level role to becoming more high-end, more Epic Analyst, more mid to high-level role in health IT? So it is possible. For those that have asked me in the past, it is possible. He is a living example of that. So just keep on pushing. What's your final advice for someone watching that has listened to this whole thing and they're like, I want to do this. I don't work anywhere where they have Epic. I can't get that access. I can't get that. What should I do? What's your advice for that person?
So if you don't have access to Epic currently, I would advise people to start working for a healthcare organization that does use Epic, number one, because that way you have access to all of Epic's training and resources in your hands. Right? If you don't work for them, then you don't have access to that. If you are a person that works in education, then I would recommend for you to look for Epic credential trainer jobs, since you don't need direct Epic experience for those jobs. And the other thing that I would recommend people to do is, especially like roles like what I did, which is a patient service rep, would be to pick up on projects that you don't necessarily have to do. So do extra work to learn new things. For example, I forgot to mention this when you asked the question earlier, but when I was working at the radiology department, I picked up a project on how to better manage CD requests. So in imaging, patients ask for CDs sometimes of their images, and these CDs were getting lost because we had a bunch of CDs that weren't sent out because we didn't have the staff and we didn't have a system to track them. Did this CD go out? Did this CD come to us? Like, Kaiser Permanente is a big facility it's a big organization, and there's multiple facilities throughout Northern Virginia. So there had to be a system to track all of these CDs going different places, and just that wasn't there where I worked at. So I decided to take on that role of tracking these CDs in and out, on top of me being at the front desk, checking in patients and scheduling. I didn't get paid extra for that, obviously, but it was a good learning experience, and it's good to add, and it was a good experience to add onto my resume. So a lot of these jobs require you to work on projects, and then I just added a section of projects and then what I did there. And I feel like that kind of helped me get my first, like, even Epic credential trainer job, because they see that I don't just do the bare minimum. I go above and beyond. So if they hired me as an Epic credential trainer, I'm not just going to take on one application, two applications, but we're going to take on more work. And I feel like that helped me a lot.
I want to thank you so much for joining us today. Thank you for sharing your knowledge. For those that are considering or were thinking about Epic, hopefully this helped you to get a better grasp on what to do next. And once again, please follow him on his YouTube channel. And also follow him if you have Epic access. I know that may be a group of people, but follow him on there. And he has a lot of helpful information to help you get that first job. I'll put the details in my description below. All these links, I'll put it in for you guys. So you're good. So thank you for joining. Thank you guys for watching. And I will see you guys somewhere on social media in our next episode of the Health IT Playground. Bye, everyone.